there will be a scenario first, and then there will be a question, and then there will be 5 choices, and you have to choose one of the choice. There is no negative marking. This is very good because you can obviously choose whatever you can. The passing score is not exactly 60 to 65%. Passing score is basically, there is no score for passing. Basically, it decides on your peers. Let's say, for example, you have 10 candidates, and all 10 candidates get an average mark of 60%, then the passing will be 60%. Let's say they get the average of 50%, then 50% will be the passing. So there is no passing score, basically. You have to compete with your peers at that time. So it's not something like 60. If you get 65%, you will pass. If you get 75, you will pass. No, it's not like that. Okay. So exams, PLAB 1 exam basically held in 4 months: February, May, August, and November. And there are a lot of countries, obviously. Important thing is result. Result comes within 4 weeks for PLAB 1. And for someone who needs to sit for exam again, the good news is the maximum attempts are 4. But hopefully you will clear your PLAB 1 within 1 go. Now the question structure is, as I told before, that it will be a short scenario, and there will be a question and then 5 possible answers, and you have to choose one. There is no negative marking, so you can choose any one of the choices. So it's you can do this thing in 1 minute if you have good practice. So that is why practice is very important. If you don't do practice, then probably you will waste 2 or 3 minutes in just reading the question. So it is very important to get a good practice. Now, what subjects to cover? Basically, as I told before, that it concludes all clinical scenario and clinical management. So you have to cover all the subjects. It's not pick and choose. It's not something that, okay, I'll go with respiratory medicine and I'll leave gynecology. No, you have to have a good knowledge. So you have to cover all the subjects. Okay. I think you can see that we are having 24 subjects here, but it's not like that. So you have to cover everything, every basic and complex thing. Okay, be prepared. Next, about exam dates, you can, by the way, you can find all these information on GMC website also. So currently, 2024, the exam date is 15th of February, which overseas closing date has passed, 4th of January. But if you are in UK, then you can apply for this exam. The 1st of February is the closing date. I'm not sure whether it's still available or not. Moving forward, I think 23rd May, then exam date. Overseas doctors have to apply on 11th of April, before 11th of April. And obviously, if you are in UK, you can apply later also. So this is basically a schedule for 2024 exam dates. We have 15th of February, then 23rd of May, 8th of August, and lastly, 7th of November. Regarding fees, this is a basic structure of PLAB 1 and PLAB 2 fees. Okay, now coming to PLAB 2 exam structure. PLAB 2 exam structure consists of 18 stations. In 18 stations, we have 2 resting stations. So basically it is 16 stations. Now we have 8 minutes for each station. There will be a bell, you can say a reminder bell, at when the 6 minutes will pass. So they will let you know that you have 2 minutes left. So continue with your station and complete it as soon as possible. The exam criteria, or you could say the marking criteria, is basically divided into 3 things. First is history making or data gathering. Second one is clinical management. And the third one is interpersonal skills. All carry equal marks, 4 marks each. So if you are good in data gathering, you can have 4 marks there. If you are good in clinical management, you can have 4 marks there. If you are good in interpersonal skills, you can have 4 marks there. So basically, maximum number of marks you can get from a single station are 12. Now, passing score for each station is 6 plus. I don't think so. It's not like that. There is no passing score for each station. You are competing with your peers, with your colleagues. So depending on that day, depending on your colleagues, let's say, for example, if there is one station of breaking bad news, let's consider this. So you have 10 candidates. The station is breaking bad news. And if the average of that station, yani all average among these 10 colleagues, the average is 6, then the passing score will be 6. If the average is 3, the passing score will be 3. If the average is 9, the passing score will be 9. So most of the guys will be hoping that maybe, hopefully, I'm competing with the duffers. It's like that basically. So it does not, it does not mean that if you have 6 plus, you will pass. Okay. So exam is held throughout the year, and this exam is only held in UK for the time being, only Manchester. The result will be coming after 2 weeks. You have to complete this PLAB 2 within 2 years of passing PLAB 1. OSCE examination, all OSCE examination are basically clinical knowledge examinations. So you have to complete all those things, okay? Again, last point is not clear. Must clear 12 out of 18. I don't think so. It's not like that. Minimum, again, you are competing with your colleagues. So out of 16 stations, minimum is 10. But again, it depends. There is very confusion about this thing, that how many stations we have to clear. So basically, you are competing with your colleagues, and on that day, the average will be different for some, let's say, 1st of January candidates, the average will be different. 2nd of January candidates, the average will be different. Okay. Exam booking process, you can go and check the GMC website, and you can start your processing, booking. It takes a lot of time, but you have to have some basic knowledge, what you have, what you don't have, and if you don't have, kindly gather it. There is a refund policy also. Okay, resources for PLAB 1. I'm sorry, I'm doing this presentation from my mobile, my laptop. I'm not sure why it's not working, but I have updated this presentation there. Let me just open that. Okay, I'll leave it. So resources for PLAB 1. As I said before, PLAB 1 is basically covering all the subjects, all the topics. So you have to complete, you have to take care of all the subjects. So there is basically no resource for PLAB 1. You have everything for PLAB 1. You can go to your MBBS books, you can go to some online books, you can go wherever you want, whatever you want, but just prepare for whatever you have on your hands. Okay, so there is no, basically, we cannot pinpoint, okay, these 10 books or these 5 books or these 2 websites are basically for PLAB. It's not like that. And the most important thing is, at Med Instutors, we are here to help. So if you need anything, you can ask anything from us, and we will definitely guide you how to do it. Okay. Same for PLAB 2 resources. Again, PLAB 2 is an OSCE examination, clinical examination. And the important thing for PLAB 2 is to have a partner and practice with him or her. So the partner is very important. Practice is very important. So there are few websites available. There are not few, a lot of courses available, like Med Instutors. So you can join anything. Med Instutors are always here to help, of course. Now, the tricks to pass PLAB 1. Very tricky question again. The trick to pass PLAB 1 is basically practice. Okay, you have to have a good knowledge. You ought to know that you have to complete this one scenario in 1 minute. So if you have no practice, you will not do that in 1 minute. So just buy some online question bank like Instutors, and then practice. If you are good at it, you will do it. Okay. And practice to complete the scenario, to complete the question, you must have a background knowledge. So your knowledge is very important. Okay. So the trick is to practice, to do the MCQs, because you have to complete the MCQs within 1 minute, one MCQ in 1 minute. So if you have good knowledge, but you don't know how to complete the question in 1 minute, you will lose a lot of marks. Okay. Now the trick to pass PLAB 2 is basically, again, eat, sleep, practice, eat, sleep, practice, repeat, eat, sleep, practice, repeat. Okay. Because PLAB 2, and like all OSCE examinations, is clinical examination, and for clinical examination, your acting skills, your communication skills, obviously your background knowledge, everything counts. So you have to go through all this. And Admin Instutors, we will try to guide you as much as possible. So this was my presentation. I hope it was helpful. It was a basic presentation, not something very complex. So I'm here to answer any questions if you have, please.
Yes, sir. There are some questions in the chat box. Can you answer them?
Yeah, please let me. Where can I go from there? How can I go there? Okay. I'll go one by one. Okay. So I'll start with doctor. These are basic subjects. How many total subjects need to cover? Well, again, as I said before, there are no total subjects. You have to cover everything. Okay, please don't leave one thing and okay, I'm not good at the gynae obs, so I will leave it. Please don't do this. Okay, you have to have a good knowledge. Lab is not something very easy. Yes, it is easy, but not very easy. So please don't do like this. Don't pick and choose. Okay. Other question is by Abid Khan. Can candidates request a change of exam date if unforeseen circumstances arise, and what is the procedure? Yes, you can do that. GMC guys are very helpful. If they find out that you have some unforeseen circumstances, definitely they can do that. You just have to email them. You have to make an account there first, obviously, and then you have to email them that this is the issue, and they will help you out. No problem. Next question is from Eileen. When we can book next exam? Well, as I showed you earlier, I think the next would be 4th of January has passed, so I think the next exam will be later. You can check the GMC website, please. Can you please mention resources for preparation? I knew that everyone will be asking for resources. Again, as I said before, there is no 1 or 2 or 3 or 5 or 10 books to prepare for PLAB. You have to have good knowledge from anywhere you like, okay? Anywhere. Whatever books, whatever sources, whatever website, whatever you have, just prepare from there and you will have good preparation. Obviously, you have to do the MCQs. So MCQs are very important. Whatever knowledge you have, you will convert these knowledge into MCQs now. So MCQs, doing MCQs are very important. At Med Instutors, we will help you out. You can contact any of the representative of Med Instutors, and they will guide you how to prepare and from where to prepare. Okay. Uh, do you recommend any academy? It is a very tricky question. No, I don't recommend any academy. Academies are there for help. Okay. They don't guarantee you that you will pass the examination. They are only there for help. Okay. So if you, I did not take any academy. So if you want any help, you can, by the way, I did not take any academy because I did not have time. I was not very studious. I did not have time. So, okay. So if you want to join an academy, yes, you can join the academy. It will help you out, but be prepared. There are a lot of academies there who just extort your money. So be prepared, please. Can candidates, another question from Irha. I think I'm pronouncing the name correctly. Can candidates request a re-evaluation or appeal their exam results? And what is the process involved? Yes, you can do that. There is one re-evaluation allowed. You can do that. Process involved is again the same thing. You have to email the GMC website, GMC people. How transparent is the score reporting process, and what information is provided to candidates along with their results? How transparent? Well, you are talking about one of the key players of medical world, GMC, General Medical Council. So how transparent is the score? I would not I would not comment on that. And what information is provided to candidates along with the results? Just your knowledge-based answers. Yani, for example, if you have, let's go through PLAB 1. If you are going through PLAB 1, they will tell you that you have answered these, how many questions correctly, and your clinical assessment and clinical knowledge was average, above average, or below average. Okay. Like that, sorry. For PLAB 2, they will tell you that, again, your 3 domains of interpersonal skills, clinical management skills, and data gathering skills. They will let you know about these things. For data gathering, let's say example, data gathering skills, that for, again, taking the same example, Breaking Bad News. If you have this station, so your data gathering skill was good. Out of 4, you got 4 or 3 or 2 or 1. Clinical management skills was okay, 4, 3, 2 or 1, and the interpersonal skills 4, 3, 2 or 1. So basically, they will mark you and they will tell you that in interpersonal skills, you got this number. In clinical management skills, you got this, and in history taking, you got this. I hope I'm clear. For PLAB 1 and PLAB 2, both are different, okay? When we can start preparation earlier? As the answer is as early as possible. It depends on person to person, obviously. Someone who is good at reading, they will do preparation in 1 month. Someone who is not good at preparation, but he has time, he can also do the preparation in 1 month. Someone who does not have time and does not is not good in reading or something, maybe he will need 6 months. So it depends basically on your circumstances. That, but as early as possible, if you start your preparation, you will have a good chance. Other question is from Abdullah Basharat. Can you tell us exactly how many years does it take after passing PLAB to become to become a consultant? What this about trainee and non-trainee doctors? Abdullah, I'm not answering this question for now. It is beyond my scope, okay? But it was a good question. Now, sorry, Abid is not. Irha again, is med revisions enough for preparation? Okay. I think med revision is some kind of website. Irha, I'm not sure about that. As I said, I did not, and there are a lot of candidates who don't prepare from some specific website or specific, you can say, book. So if you are saying that, okay, this book or this website is enough for preparation, I would reply as no. Why? Because I need you to prepare as much as possible. I need you to prepare from everywhere. I need you to prepare fully. I need you to be fully prepared for exam. So please don't rely on one source. Yes, you have to choose one source, but please choose wisely. So med revision is enough for preparation. I would say no. Okay, now we have Bilal. I've completed the Plabbable and Plab keys resources for Plab preparation. With 10 months remaining until the November 24 exam, do you recommend starting med revision? Okay, Bilal. Bilal, you have done 10 months for your exam, so you can do anything in these 10 months, okay? I think it is better to be in practice. So if you have completed Plabbable and Plab keys, yes, definitely you must have something to refresh your knowledge. So if you want to do the med revision, yes, you can do that. I would recommend that because I don't want you to get rusty. So be in practice, okay? MB Harris says, can we just do recalls as well? Recalls, if you are asking for Plab 2, I think. Yes, recalls are very important. You have to do the recalls because recalls sometimes repeat. So Harris, MB Harris, yes, recalls are very important. Now we have Khansa. So in short, the trick to pass the exam is just to practice the question as many. Yes, 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 Khansa. As many as possible. As many as possible. This is very important. Again, you must have a good knowledge. But if you have a good knowledge and you don't know how to convert that knowledge in exam, then you will not pass the exam. So practice is very important, please. Moving forward, Irha, thank you so much. Welcome. Wonderful. Okay, so no questions. Thank you all. You have written wonderful session. Thank you so much. Welcome everyone. It was nice meeting you all. And if there is any question, kindly you can ask me here also, and you can ask the PLAB Instutors guys also. They will convey your questions to me also. I hope I've cleared everything. Let me go through again. Yes. So we have to say one more question. So we have to study whatever we study in our 5 years of I think, Abdullah, you need some answer for this. And no, Abdullah, it's not like that. You don't have to study whatever you study in your 5 years of MBBS, but you have to have a good knowledge. Okay. So you don't study anatomy, don't study physiology, don't study biochemistry, don't study these subjects. Okay, you have to have a good clinical knowledge. So I would not say you have to study all 5 years of MBBS. Yes, but you have to study the final year of your MBBS. Okay, because whenever you start your clinical, I don't know, you start your clinical from third year or fourth year or fifth year, but wherever your clinical practice and clinical knowledge, this will be tested in PLAB. Your basic knowledge will not be tested in PLAB. Okay, clinical knowledge. Usually, clinical knowledge starts from the third year, but the most important of them all is the final year. The main topics: surgery, medicine, gynae ops, ENT, eye. These are the main clinical subjects. Anatomy, physiology, biochemistry are not the main subjects, so you can leave them. I hope, Abdullah, I'm clear now. Welcome, welcome. Any question, guys?
Sir, I guess we have cleared all the queries. Thank you so much for this wonderful session and knowledge. We will see
No
you
problem.
again.
Inshallah, inshallah. Anytime. Thank you, guys. If you have any question, kindly contact them at Instutors. Okay. Bye bye from now. Take care.
Bye bye, sir. Allah Hafiz.
Allah Hafiz.